And happy midweek to all, and thanks for joining us as we continue our conversation on reopening Orange County and what we all can do to make sure that this happens in a responsible manner. With information on what is taking place today in this press conference, we have with us the Honorable Mayor of Orlando, Buddy Dyer, who will give us an update on the city. We, of course, have information on the testing sites by Dr. Yolanda Martinez, the Health Services Director for Orange County, and new information, statistics, and other information from the state, where we stand here in Orange County, to be delivered by Dr. Raul Pino, the Director of the Florida Department of Health here in Orange County. But first, we begin with an update and an overall view of what's taking place with our Mayor, Jerry Demings. Mayor?
Good afternoon. Let me begin by saying thank you to the media for always covering our updates regarding the pandemic. This afternoon, we're going to cover 4 things during this press event. First, we'll talk about a review of the measures being put in place to keep us safe. Secondly, we'll report out on the work of our Economic Recovery Task Force. Thirdly, we'll provide an update on the pandemic here within Orange County. And then we're going to start now as we recognize many of our frontline workers. So let me introduce them to you. I asked Mayor Dyer to come up and join us, but I'm going to say to some of the nurses in the audience, as I introduce you, I'm going to collectively introduce you. Let me say that another way. We're going to individually introduce you, but then collectively we want you to come up and join us in just a few moments. And when that occurs, I know there are some other elected officials here if you all want to come up at that time, but let me just introduce these individuals. First, we have Ms. Renee Leonard. She's 32 years as a nurse. Renee, if you can stand at this time. Then we have Ms. Kimberly Zimbauer Kane, 16 years as a nurse. Ms. Jennifer Senserman, 6 years as a nurse. Ms. Alicia Ford Walker, 28 years as a nurse. And Ms. Janet Gorian, 40 years as a nurse. And Ms. Marlene Andrioli, 15 years as a nurse. So I introduced them because today begins the start of the National Nurses Week across America, and our nurses are known as the heart of healthcare. So won't you join me if you elected officials will come forward and nurses come forward for a quick photograph. We're going to put you all right in front between Mayor Dyer and I. Kind of social distance. Okay. We all masked up. One of you come on this end. One of you want to come over? One?
Just because we have the podiums, let's shingle a little bit. Turn sideways.
Okay. There you go.
No one breathe. Excuse me, teammate. Good. And my dad?
Thanks, Mayor.
All right. Thank you all. Let's give them another round of applause. Thank you all for the job that you do each and every day as we recognize our nurses. These are our heroes and sheroes in this community. So let me just formally start the press event this afternoon. This is day 3 of the phased reopening in the state of Florida. And slowly but surely, we are navigating our new normal here within our community and within our state. As restaurants and retail establishments are reopening, I'm reminded that we really don't have a timeline yet for our local theme parks, which are so pivotal to our overall economy here. But I'm encouraged that Shanghai Disneyland will open with precautions on Monday, May the 11th. We will keep a close watch on their progress. And now, let me give you an update on what's happening here within Orange County. Orange County has 1,460 cases of COVID-19, which is an increase of 14 cases since yesterday. Orange County residents who have lost their lives to this disease now number some 36. In just a few moments, you'll hear from Dr. Pino, who will talk more about that. Our testing continues to remain robust in this community. We have now done some 32,000 different tests countywide. Our testing site at the South Orange Youth Complex will close after today. We're going to move that site to another location. The Ventura Elementary site will remain in place for the time being. On Thursday and Friday, there will be a test site at Legacy Middle School in the Waterford Lakes area. On Monday and Tuesday of next week, there will also be a testing site at the Lakemont Elementary, which will service Winter Park, Maitland, and the town of Eatonville. Appointments are necessary, and details can be found at ocfl.net/coronavirus. Dr. Yolanda Martinez will have more details that she'll share momentarily. The full Economic Recovery Task Force has just wrapped up its meeting just a short time ago, just about 15 minutes ago. There are a lot of moving parts to consider as the task force works to get our community up and running, and here are a few highlights from the work of the task force. The Business Compliance and Consumer Confidence Working Group made a motion to recommend that Orange County consider performing an electronic survey that gauges consumer confidence around reopening our economy. That motion was unanimously passed by the full task force. The Business Readiness Working Group is discussing how to distribute the large amount of personal protective equipment, or PPE, procured by the county. Distribution is expected to start on Monday of next week. We plan to redistribute 1 million masks, 200,000 bottles of hand sanitizer to small businesses of 25 or fewer employees and nonprofits. The goal is to impact 20,000 different small businesses by providing them with PPE as they reopen. The Bringing Back Tourism Working Group has come up with a 3-tiered approach to ensure Orlando is top of mind when it comes to travel. The group is working on ways to build trust and ease concerns and drive demands for a strong share of the travel market as we work to restore our economy in the coming months and years. And finally, the guidelines for the Business to Reopen Working Group is following up on the governor's discussion to reopen personal services such as barbershops, nail salons, and hair salons. All of these meetings were carried live on Orange TV for anyone to watch. Please know that as your mayor, my top priority during the pandemic is trying to make certain that we have an orderly transition to reopening while keeping everyone safe. I would also like to address a few requirements with regard to the restaurants. Orange County has developed guidance criteria for restaurants that operate in unincorporated Orange County. First, we must abide by the governor's executive order, which can allow no more than 25% indoor occupancy, and outdoor seating is permissible with appropriate social distancing. Restaurants must also follow these requirements. For restaurants with pre-existing outdoor seating, there needs to be separation of at least 6 feet, and the seating cannot use any public sidewalks or right-of-way. For restaurants without existing outdoor seating, the temporary seating must be located on private property, adhere to the 6-foot separation, shall not use parking areas or drive aisles, and are not allowed on public sidewalks or right-of-ways. In addition, for shopping or multi-tenant centers, they need property owner permission, and if using private sidewalks, they must allow a 4-foot ADA path. Tent permits are not required if they are less than 12 feet by 12 feet in size. Larger tents require a permit and cannot block sidewalks or using parking areas. We will post that information on our website and share that with the media. And finally, allow me to address the executive order that I issued on Friday and how it pertains to religious gatherings. My executive order encouraged religious leaders to follow all CDC guidelines where it comes to religious services. That included the importance of hand washing and using hand sanitizer, as well as suggested limits on in-person indoor services to no more than 10 people. These guidelines are not mandatory, however. They are encouraging our local religious leaders to remain responsible and continue to follow best practices, which are the CDC guidelines, so that the coronavirus does not have a chance to spread in the faith-based community and community at large. We will be holding a virtual town hall with our faith-based leaders next week, Thursday, May the 14th, at 2 p.m. to 3 p.m., 2 p.m. to 3 p.m. And many of you in the media are aware that I received a letter from the Liberty Council, and I have responded to that letter, and we'll be happy to make a copy of it available to you. And with that, I'm going to ask Mayor Dyer to come forward and then share additional comments.
Thank you, Mayor Demings, and thank you all for being here. I'm very thankful to be here again today as we continue together as a community to fight the COVID-19 pandemic. And while at the same time, we are learning to live responsibly while the virus is still here in our community as we carefully begin the first phase of our reopening. I want to thank our community's business owners for their patience and for being active participants in our efforts to slow the spread of this virus. Just this week, following the new opportunities the city put in place on Monday, businesses are already taking advantage to further ensure they're opening and operating safely. Cecil's Barbecue in the Soto Main Street District, Stardust Video and Coffee in our Audubon Park Garden Main Street District, and Linda's La Cantina, one of Orlando's oldest steakhouses, are all expanding their dining rooms outdoors and into their parking lots. And I'm happy to see that our local business owners are taking the steps to protect the health and well-being of their employees and customers. Their actions show once again that we must have public health to ensure economic health. I continue to be proud of our Orlando community. One of our greatest strengths is our compassion and our concern for our neighbors. We have especially seen that during the course of this crisis as we found ways to support one another from a distance, including yesterday's Giving Tuesday campaign to help provide crucial funding for our not-for-profits who are providing assistance during this time. And I want to thank everybody in our community that donated yesterday, and to the Heart of Central Florida United Way, who raised $70,000 to providing funds for those who most need it. I'd also like to thank Universal Parks and Resorts for working with its parent company Comcast and Tencent, its technology partner in China, to arrange the donation and delivery of 600,000 masks, 300,000 K95 masks to frontline healthcare workers in our community. And I also want to join Mayor Demings in recognizing National Nurses Day here in the city of Orlando. Tonight, we will be lighting the Lake Eola Fountain Lights blue, recognizing the courage and compassion of our nurses and all of our medical professionals in our community. And you'll remember, one of the reasons we stayed home was to protect our frontline healthcare workers. We still have the power to protect them and every single person who calls Orlando home by wearing a face mask, whether it's a Gator face mask or a UCF face mask, when leaving home, and being diligently to practice physical distancing and, of course, good hygiene. Let's keep it up, Orlando, for all of the nurses and all the medical professionals and each other. Dr. Martinez.
Thank you very much, Mayor. Well, good afternoon to everybody. Today we mark day 6 of the testing that Orange County Health Services has started in partnership with Orange County Public Schools, the fire department, and some of the other components within the county itself. We've been running tests at Ventura, as the mayor mentioned, and South Orange. At Ventura, we completed today a total of 1,071 tests, and at South Orange, 900. That means that we're a very low positivity rate because of 89 tests that came in last night, only one person was positive. And you might remember that on Monday when I provided the numbers, I said that we had 525 tests that came back, and of those only 4 were positive. So of over 600 tests, we only have 5 positive individuals. Today, we closed the South Orange Youth Sports Complex in 32824 due to decline in appointments. The residents that had already made appointments for Thursday and Friday were called and/or asked to make appointments if they could for Wednesday and told where the other sites were in case they wanted to go to another site. We're moving the team that was at South Orange to Legacy Middle School, as the mayor mentioned, and that will serve the 32825, 32828 zip code area. Those two are adjoining zip codes that are the second highest in cases in the county. So we'll be able to provide testing there. And we're planning for now to be there on Thursday and Friday, but we'll accommodate if necessary. We'll be there from 9 to 4. And for those who want to make an appointment there, www.ocfl.net/Legacy Middle. The number of residents in the testing site at Ventura continue to decline as well, although we will continue to run the site through the close of Friday. We will be analyzing and towards the end of the week and making a decision whether we will remain there or move to another location. As the mayor mentioned, Monday and Tuesday we'll be at Lakemont Elementary, and that will serve the Tri-City area of Winter Park, Maitland, and Eatonville. And to make an appointment there, please visit www.ocfl.net, Lakemont Elementary, and we'll be there from 9 to 4 as well. And if you have a difficulty making the appointment over the computer, you can call 311 if you don't speak English, and they'll help you there. And finally, I wanted to thank Deborah Andre, Dr. Andre at Community Health Centers. She opened a drive-through testing at the Apopka Community Health Center. The Community Health Center is a member of the PCAN network, and she did that as a request from the county. So we're very grateful for her listening to us and the need in the Apopka area and opening that site. They opened on April 28th. They've been seeing approximately 20 residents per day. And they're open on Tuesdays and Wednesdays from 9 to 4 to do testing there. And if you are in that area and would like to call, you need to call 407-905-8827 to make an appointment. So we're very grateful for that component. And with that, I'd like to introduce Dr. Pino. Thank you.
Good afternoon. As the mayor mentioned, we have accumulated 1,460 positive cases. And we stand today at 4.5. Last time that we talked to you, we were at 4.9. This is one of the indicators that we will continue to follow really close as we reactivate our economy activity. A fatality was added to our list, and our prayers and thoughts with the family, 81-year-old male, white, non-Hispanic. We don't know the exposure yet, and it has pre-existing conditions. We also would like to show you the metrics that we are going to continue to assess to see how the county is performing. And as you can see, we continue to trend in the right direction in all metrics. We also are getting ready for the third round of testing, and I want to show you this county map that we did recently. It has 30,000 of the 32,000 tests that has been performed. 2,000 of the tests didn't contain a zip code, so we have to recode as we clean the data. And this is a process that always is improving and improving and improving little by little. But as you can see, the density indicates the number of tests performed on people who disclose that zip code as their place of residence. So the reason we are doing this is that we will move now our testing sites to new locations where less tests has been performed. So we are going to move a little bit to the west to try to cover that area right there in white that I cannot really see the numbers. But those places are less than 1% or 1% of the population have been tested. Our sites are going to start next week, and we encourage people from the west side of town to please come and get tested. Monday 11, we will be at Independence Elementary School. Tuesday, the 12th, we will be at Olympia High School. Wednesday, May 13, we will be back to Camping World. It's our site with the highest number of positive cases. So we will continue to do that. Thursday, May 14th, will be at Evans High School, and Friday, May 15th, will be at Prairie Lake Elementary School. The number that people need to call is 407-723-5004, and we are going to increase the number of tests from 350 to 500 a day, so to see if we can hunt this virus down. Appointments are required. We encourage people to make appointments. It is the way that we have it to have it in an organized manner, and people not waiting there 3-4 hours in a line of cars. And no payments are necessary, only people who are 18 years or older. In general, we tested 3,109 people with a positive rate in this mobile testing for 0.7%. The last week of testing, we did not report on Friday or Saturday. So last Friday, we tested at Blanchard Park on May 1st. 476 people were tested, only one positive for 0.2%. And on Saturday, May 2nd, we tested 373 individuals at Barnett Park for a positive rate of 0.8, with only 2 new cases reported that day. With that, I pass it down to Mayor Demings.
Okay, with that, we'll open it up for any questions that you may have about anything that we have discussed at this point.
Hello, Lauren Seabrook, Channel 9. Mayor, realistically, how much enforcement is going on when it comes to some of the things that maybe the restaurants are doing? Is it all complaint-based, or is there any kind of proactive enforcement that's going on to make sure people are doing the right thing?
I think at this point, we still do not have a significant number of restaurants that have reopened, and it is largely being driven by complaints that citizens see, and those complaints can be received. Certainly, the local law enforcement agencies can receive that. The Department of Business and Professional Regulation, which regulates the restaurants, the Department of Health, and certainly you can even call the 311 line, if you will, here, the non-emergency, but it's the governmental services line for Orange County government. And we'll triage that and then take appropriate action.
Are you hearing any complaints yet?
We had an executive policy group call, which really we do on a daily basis, and the sheriff indicated on that call earlier today that they had received just a handful of complaints reference businesses or restaurants that were not operating consistent with the directive. But overall, we see widespread compliance with the executive orders that have been issued.
And my other question is for Dr. Pino.
Dr. Pino.
Dr. Pino, some people have been asking about some things that aren't really covered in some of these guidelines for each phase. Things like, when can they be comfortable going to see their parents at another house? When can they be comfortable getting back on a flight for something that's maybe not necessarily essential, but something that they'd really like to do? Maybe start to get some smaller gatherings together, things like that. What's your advice for people?
So we tend not to advise people on their private life decisions. Government is not here for that. I think people have to assess the risk. And I know that's a difficult decision to make because many factors play into that. But if those decisions have to be made, the last decision should be to go and see people who are elderly and have pre-existing conditions. It can wait. People have been getting creative, and Dr. Martinez went and saw her mother and covered herself with a sheet to be able to give it a hug, and people are doing just that. So we advise that for now, as long as we continue to have the pandemic going on, we should protect the most vulnerable as much as we can because the consequences can be very dire.
Hi, Eric Sandoval with News 6. Again, a question for Dr. Pino and then one for Mayor Demings. Newspapers in South Florida are reporting that there are COVID-19 cases that they are uncovering that were reported in January but not being reported by the Florida Department of Health. Can you comment on any cases that may have been reported in January here in Central Florida?
So I think I had it in January myself, in the first week of January. It would be hard to go back and identify some of that data, but as people get tested for serology and try to measure immunity, I think we are going to get a better picture of how far back this was here. In some cases, people are saying that even in December, when they are going to back and revise the data, they are finding that there were cases. I think the history of this pandemic will be written later on, not today.
You're saying some of our data could be rewritten based on the serology?
Absolutely, for sure. The pandemic doesn't get that explosive that fast without having a lingering time in your community. So here, February, no, or March, no, it could have been before. And you have seen also in our data how we are moving it towards the left in time, because we are finding more and more as we interview people that they develop symptoms earlier than when the disease was diagnosed.
Very interesting. Mayor Demings, one quick question for you. Given the questions that Lauren was talking about with restaurants, and given the questions that even the Economic Task Force has had to answer in their work, do you think we reopen too soon?
Absolutely not. Not at this point. I think we have engaged in a measured approach to reopening. We continue to see those numbers decline, but only time will tell. If it appears that those numbers start going back up, then we'll have to make an adjustment. It's that simple. I depend on the Department of Health to provide us with the data by which to make decisions. Okay.
Buenas tardes, Félix Pirela de Telemundo. Tengo dos preguntas. La primera, queremos saber a los doctores, el doctor Pino, la doctora Yolanda, la importancia de que los trabajadores de los restaurantes que abrieron ya esta semana, los bartenders, los mesoneros, usen mascarillas. Es importante que las sigan usando, y se los pregunto porque el lunes, el primer día, pude constatar en un restaurante que los mesoneros, bartenders, no estaban usando tapabocas, y en ese restaurante no había ningún tipo de distanciamiento social. La gente que estaba allí ya disfrutando ese primer día, ¿no podría decir alguna recomendación que podrían dar ustedes?
Sí, mira, las máscaras son esenciales, especialmente si estás cerca, frente a frente, o si alguien está en una posición más alta que la otra persona. Porque este virus, quiero decir, alguien está sentado y la otra persona está de pie. Es importante, este virus es muy pesado, como yo he dicho anteriormente, y cae al suelo casi inmediatamente. Por eso es que la distancia de 6 pies es diferente de la rubiola y otras enfermedades, que el virus no es tan pesado y queda suspendido en el aire por un tiempo y tú puedes entrar y inhalar el virus. Este virus no queda en el ambiente. Por eso es que estamos recomendando que las máscaras no hay que usarlas todo el tiempo, pero hay que usarlas cuando están en interacciones que tienen la facilidad, no puedes estar menos de 6 pies de distancia.
¿Es obligatorio que lo usen los trabajadores de restaurantes, por ejemplo?
El condado ha tomado la opción de hacer sugerencias y no hacer mandado a que todo el mundo usara la máscara. En parte, la decisión que el alcalde tomó, según él ha explicado, tiene que ver con que no tenemos máscaras para todo el mundo y sería injusto aplicar esta medida en el momento que no tenemos máscaras para todo el mundo. Pero en realidad, una barrera protectora es importante. Es importante también lavarse las manos constantemente y limpiar la superficie. Por ese mismo sentido, es muy pesado y cae inmediatamente en las superficies.
La segunda pregunta para la doctora Yolanda Martínez. Doctora, hemos visto que la próxima semana han colocado más sitios de pruebas al oeste del condado. ¿Han visto algún tipo de indicio que los obligó a hacer más pruebas en esa área del condado Orange?
No necesariamente. Los indicios que hemos visto ha sido referente al mapa y los zip codes que tienen más cantidad de personas positivas. Sabemos que el primero es el 32822 y el 32824 lo sigue con el número de personas que han resultado positivas. Y entonces ahora estamos mirando al 32825 y 32828, que son los siguientes zip codes que tienen un gran número de personas que se han hecho la prueba y han resultado positivas. Así que estamos basándolo en eso.
Yes, the question for me was that some people were complaining about some restaurants where the service personnel were not using masks and the social distancing was not observed. And the mayor talked about that. The community needs to report when that happens, and there is a means to report that so that we can encourage and do more than encourage people to take those practices in place. And so we were saying that it's critically important to have people mask, especially in the conditions where you cannot hold 6 feet distance or there is no barrier between the individuals. And also it's very important to clean surfaces because this virus is very heavy. It drops into the surfaces rather quick and stay alive for a while. They say a couple of hours, 3 hours, 5 hours. So that's getting to be analyzed. But it's also important to wash your hands. Soap is the best antibacterial that you can have. Alcohol, if you have it, fine because it's portable, but soap is the best. This virus also has a corona, that's what is called coronavirus, that is heavy in proteins, and when you wash with soap, it dissolves rather fast.
Good.
Why are we making the decision to move the sites to the other locations? And the response was that we're basing it on the heat map, where you can notice the number of cases that resulted positive. We started with 32822 because that is in our county the site that has the largest number of positive cases, followed by 32824. And now we're moving to 32825 and 32828 because those are the next zip codes that have shown large number of positive cases. So that is our sort of our methodology and our rationale.
I got one for Mayor Demings and then one for Dr. Pino. So, Mayor Demings, we've gotten a lot of complaints from businesses in Orange County who are being threatened to be evicted by their landlords, and they're struggling just as much as residential people, because a lot of them, even in phase one, as you've talked about, are not open yet, and hair salons, gyms, places like that. And so there's no protections in the governor's executive order. There's no real protections for them in the county order that was put out by the chief judge. Are you willing to offer some kind of protection to these the businesses here in Orange County from being evicted while they have to be shut down?
Okay, that's a complex issue because property owners have a right to reclaim their respective properties. However, pursuant to the order of the Chief Justice of the Florida Supreme Court that gave direction to all of the various circuits, and here we have Chief Judge, there really is no mechanism by which the government at this point can enforce the eviction processes. So if you go to the clerk of the courts to complete paperwork for an eviction to occur, the sheriff is not serving evictions. The clerk is not processing the paperwork pursuant, again, to those orders that I enumerated. And until that changes, you will not see what customarily would have been done, where the sheriff within the county or his designees would respond and actually evict you from the process, from the property using the established processes. That isn't happening today. And so at some point, that is going to change. So for now, if you are a tenant, you have some solace, at least, in knowing that the government cannot come in and do that. Now, that property owner who is continuing to have to pay, in many cases, mortgage payments on the property, and for them, they'd like to have a paying tenant because it is causing them a financial hardship as well. So it's a complex issue. I think that we will look to further direction from the courts in the near future before anything can change in that regard.
Because again, it's these businesses, I mean, they're not making any money. I mean, they're literally shut down, so is there any talk on the task force or anything about that, about helping them out and during this time, and
because even the task force cannot make law that supersedes the state law, if you will, or the position that we're in at this point. As a division of the state, we're subordinate to the rules of the state in that regard. So until after the pandemic passes and new laws are written in terms of tenants' rights, that is something that is for discussion for another day.
Okay. And then quick question for Dr. Pino, if we could.
Yes.
Okay. So the governor announced that the Orange County Convention Center testing site is now adding an antibody testing lane. Is this the first large-scale antibody testing we've got in the county? And if so, what's the impact that this could have, on testing here?
So our hospitals, our systems also are doing antibody testing for the employees. And so I will not be able to, well, potentially that's going to be the largest. I mean, they have a large volume. They can do up to 700 tests a day. The significance of antibody testing, especially for healthcare workers, and that's why the government is initially concentrating the efforts in healthcare workers, is that it will give you the ability to understand who has been exposed and develop immunity to the virus. With that, potentially, I don't know how the hospitals are planning to use it, but potentially what you can do is also be able to rotate your staff and develop your staffing patterns and put to the front lines those people that already have immunity so that you can protect those who may not have it yet. And so that's the principal role that is going to play in clinical settings. In non-clinical settings, what is important is also for the same reason. If we have to set back a little bit or hit pause, our economic activities could continue with people who have already immunity to the virus. So, and if that immunity is larger than we suspect, then our economy could sustain even when we retract people who could be more vulnerable to the virus. So it's going to be critical, important also in how we protect and who we protect from exposing them to the disease. And I got a little delay to the microphone because I was reading a text from an individual. When I say it's not mandatory the use of masks, I was referring to the community at large, not the places that are opening.
Alibet Suárez para Más 100.7 FM. Mi pregunta es para cualquiera de las comisionadas. Puede ser la comisionada Maribel Gómez Cordero o la comisionada Mayra Uribe. Básicamente lo que quisiera saber es si han podido visitar sus distritos, los diferentes restaurantes, así como los negocios, y saber cuál es la respuesta de los diferentes propietarios de estos negocios, cómo ha sido para ellos reabrir nuevamente y, bueno, si han tenido la capacidad de cumplir con todas las líneas y las guías que ha dado el condado.
Buenas tardes, good evening. Suavecito, Ali. Empiezo otra vez. La primera pregunta, ¿cuál era?
Mi pregunta era básicamente, ¿han tenido la oportunidad de ir a visitar los diferentes negocios, así como los diferentes restaurantes, para escuchar las respuestas, es decir, el feedback de los diferentes propietarios y saber cómo han podido manejar todas estas guías, estas líneas que se ha dado al reabrir nuevamente el condado?
Claro que sí. He visitado unos cuantos restaurantes. Muchos se han llenado, mucha gente todavía no quieren sentarse en los restaurantes y lo que hacen es que hacen pick-up, delivery, o sea, van y lo piden. Y me he puesto, ¿verdad?, un proyectito donde estoy recorriendo algunos de los business de los restaurantes para darle más promoción y voy con el dueño y le doy, ¿verdad?, le exhorto para mover la economía, para que ellos, ¿verdad?, puedan prosperar. Es difícil, todavía la gente tiene la mentalidad que no quieren, ¿verdad?, salir afuera, algunos no quieren, pero otros sí, pues...
¿Todo el equipo para funcionar? O sea, sí, con los tapabocas y todo.
Sí, ellos, en todos los restaurantes que he ido, ellos tienen sus máscaras, tienen sus guantes, todos los meseros tienen también y de una distancia, las mesas están puestas con una distancia que es lo que se está pidiendo y el número del 25% también se está viendo efectivo. So, yeah, that's happening.
Gracias.
So the question was that how the business, if I have visit some of the business and the small business and restaurants around the district and if they are functioning with the guidelines and the 25%. And I told her yes, and, they're trying, but they still, people and family that they don't want to go out, they just, call and pick up and doesn't go and sit in the restaurant. So, but it's running, and they're following the guidelines. Thank you.
Yes. Y mi siguiente pregunta es para Dr. Pino. Estaba conversando con él más temprano. Quisiera saber si me podría decir, ¿tienen planeado realizar los test anticuerpos para el público en general? Y asimismo también, ¿las clínicas móviles van a llegar también aquí, bueno, según los recientes anuncios del gobernador?
Sí, en algún momento haremos los antibody test. Como dije anteriormente, el Estado está priorizando los trabajadores de la salud y los first responders para entender cuáles personas han sido expuestas a la inmunidad del virus y pueden incorporarse a las tareas de trabajo, especialmente en los hospitales y en las clínicas. Con respecto a las clínicas móviles, yo pienso, nosotros lo que tenemos son clínicas móviles, lo que el Departamento de Servicios de Salud del Estado está haciendo y el Departamento de Salud del Condado y el Departamento de Salud del Estado están haciendo son clínicas móviles básicamente. Esperamos que si existen más recursos económicos podamos mejorar las condiciones de trabajo y también las condiciones en las que ofrecemos estos servicios. The question in Spanish was if we are planning to do antibody testing for the community at large. And the answer was yes, eventually. Not right now, I don't have a plan, but we know that it's going to play a role. And we also know that the state is pushing for these tests to be allocated first to first responders and clinical workers so that they receive a quick benefit and the benefit the community can get from it.
Yes, my name is Soraya from Radio Haiti Tropical. I have a question for Dr. Pinto. Yes.
Yes.
We know how important social distancing is for the well-being of the public. However, we are worried of the psychological effect that this is having on everyone. What measure are you guys taking to ensure the psychological health of the public? Do you have a plan in place for the future?
So, we are social animals, and I know people don't like that word, but we belong to the animal kingdom, and we are social. And we thrive of being social, being in contact, we learn from each other, we work together, and that's how we develop. So being social and having that interaction with a group, with a tribe, is critically important for our well-being and our mental health. And these are difficult times, especially for people who are isolated, especially for seniors who has been in their homes and being elderly and out of employment or retired, add to the fact that we have to look into mental health. And at the beginning of this pandemic, the Central Florida Consortium for Mental Health did offer free mental health assessment and therapy sessions through telehealth that people should benefit and take benefit of it. Please do not ignore the signs of depression or illnesses, social and mental illnesses, if you need to, and receive assistance if you need to. And there are conditions that can be put in place. So we have asked people to go outside to walk. And I heard an interesting analogy today. If you don't have a dog, go out and walk with your dog anyway. So go out and walk. Walk alone if you don't have to, someone who walk with, but also your neighbor. And distance can be kept, and social distancing can be kept, and masks can be put on, and people can get the benefit, especially in our weather, from the sunlight, the air, seeing other people, exercising, having a conversation, even if we're keeping social distances. And keeping social distances is not isolation, and that's a critical difference.
I'll respond to her question also because for the most part, the county funds the Central Receiving Center, which is a central location for individuals who are in crises due to mental illness, et cetera. But in addition, we normally do fund through our general budget funds for mental health treatment here within the county itself. And then a portion of the CARES Act funding that we receive from the federal government will be allocated to social service agencies, including those that will provide mental health treatment in our community. We will work even with our school districts and regarding perhaps the mental health for students or others as well. So that's something that is, the details are being defined. There's a group of individuals that are working on that here within the county itself. And then our advocacy continues at the state level to try to get additional funds for mental health treatment within the state of Florida allocated through the legislative processes. Okay. So hopefully that answers your question. Other questions?
Just a couple more back here, Mayor. This one comes from Rosinier Jean-Pierre from Radio Haiti Traffic Call. Mayor Demings, can you give the business owners an idea of when the county will have the protective equipment available to distribute to them and how the county plans to distribute that PPE?
We have already received the hand sanitizers, and within the next day or so, we will receive the masks, and first part of next week. The goal is to, on Monday, begin to redistribute that within the community using a very defined process. We will come back between now and then and provide additional information with the specifics about how the PPE will be redistributed. Again, our focus will be on small businesses where we're providing this at no charge to them. Those are businesses that are typically going to be 25 employees or smaller. And we're going to start there, and the goal is to try to impact as many as 20,000 different small businesses through providing PPE.
This next question comes from Alexa Lorenzo with WITV. Mayor Demings, you've said how important the private sector has been in helping you get the number of tests up in Orange County. With Advent Health starting to pull back on their testing efforts, how important is it for the county to continue getting test kits from the state?
Well, fortunately, we have been receiving additional testing kits from the state, which has allowed us to be able to use Orange County Health Services to do additional test sites to supplement the Florida Department of Health and the sites that it has operating at this point. The Orange County Convention Center remains a regional testing site. At some point, I'm sure the state will reassess whether or not they will continue to provide testing there for the region. Around us in the other counties, all of those counties as well have stepped up the number of test sites within their counties, and I think that has driven the demand for the regional test site at the convention center down. But we are going to continue to do testing to the extent that we can. Again, the private sector is continuing to do testing within their hospitals, within some of their sub-business units like Central Care, associated with Advent Health, et cetera. They're continuing to do testing through those sources.
And I just have one more from Melissa Thomas with Florida National News. This one is geared towards you, Dr. Pino. What are your thoughts on the number of cases now increasing again as states reopen? Do you feel the increased cases are because the reopenings are premature or due to increased testing?
It was that on Florida. We have not seen an increase of number of cases yet. Is she asking about the national numbers? Oh, I haven't followed it. Believe it or not, sometimes I turn off the TV at home because it is too much. So for mental health purposes, that's a good thing to do. I advise people to, at some point, also turn the TV off. Although the news are critically important, how we deliver messages. But if you need to, just, turn it off for a while. The number of tests it's not the number of tests going up or down, or the number of cases going up and down. It's also what is the percentage of cases that are coming back positive. And that's going to be our best measure, because that measure doesn't take into consideration the numbers, but the percentage. And so it doesn't matter how many tests you do. Well, it doesn't matter how many tests you do, but that correlation is the one that we are looking at it. So what we are looking at it right now this week, for example, is even when we have increased our number of testing through the county in the last couple of weeks, 3 weeks, our number of positive rate continued to decrease. If the virus was in abundance out in our community, that number should be higher and continue to increase. So that indicates that we have a deceleration of the pandemic in the county. Other numbers that we are looking at is hospitalizations, a death rate. We're also looking at all the metrics that we show you. Who is going to the ER? How many people are showing with fever? How many people are showing with cough? How many people has getting hospitalized by COVID-19? And all those are trending down in our county. I don't have the ability to follow the number for other jurisdictions, but I assume that we are all following the same patterns.
Okay, I don't think we have any other questions, or do we? No. Okay. All right, thank you all for joining us today for this press conference. We'll conclude it at this time.